Has anybody here heard the starfish story? I love this story because it really describes sort of my why I do what I do and why I practice like I practice. The starfish story is there was an old man walking down the beach, and overnight in a bad storm, hundreds of starfish had washed up on the beach and were just slowly dying. And he was walking along and picking them up and throwing them back in the water, just nice and steady, one at a time. And some younger kid came by and said, "What are you doing, old man? You can't save all those starfish. There's too many." And he picked up a starfish and he said, "You're right, I can't save all of them, but for this one, it's making a huge difference. I can save this one." So people just don't know about what we do in this kind of care. So part of the reason I wanted to share this with you, guests or prospective patients and my current patients, is just to know that there's a lot of people out there that if they knew this, they would want this. And they're not going to know it because they're not going to hear it anywhere else. So please share it with them. And what I tell people is, we don't, even if it's your mother in Sheboygan, Wisconsin, or your sibling in Colorado, or your college roommate in Florida, we have a network of guys that do this kind of specific work, so they don't have to be here. You let me know. I'll be glad to do my best to try to find them the right person so they get the care they need. That's the most important thing. It doesn't have to be here. Now, of course, if they're local, we'll do anything we can to help them, and that's we'll sit down with them and see if we can help them and go from there. So let me tell you about my story. I always, they say if you're going to speak in front of someone, you should always have a suit on. So that's the best I can do. I'm not going to wear a suit. I've been practicing all day, but I do look good in this suit, don't you think? So here's my mother, and this is me. But my story is this. I was a breech birth. I have a misalignment from an early age. I played football at this size. I wasn't a big person all the way through college. I've had car wrecks and concussions. I've had surfing injuries where I hit my head on the bottom and one eye dilated. Just had a lot of spinal. I've been to chiropractic school where we practice on each other. There's no other way to say that. And so my spine was really bad. And that's probably one of the reasons I practice the way I do, and I'm such a stickler for good corrective work, because without the specifics of this kind of care, I wouldn't be healthy and where I am today. So I'm not going to do anything different for my family and myself. I'm not going to treat my patients different. My mom was diagnosed in the early 60s with MS. She had the white spots in the brain and some of the early symptomatology. And when I was a child, we'd go to these MS Christmas parties, and I'd always do the MS readathon where you'd read books and raise money, and I always won because my mom had it. I didn't fully understand it, but as a kid I wanted to help my mom as much as possible. But we'd go to these Christmas parties, and these are people we'd only see once a year, and it was interesting. Even as a child, every year there'd be a new person there, and they'd come in, and the next year they'd have a cane, and the next year they'd have a walker, and the next year they'd have a wheelchair, and the next year they wouldn't be there. So it's a pretty tough diagnosis and a high mortality rate, and it's just a progressive degenerative, it's a terrible disease. But my mom, we'd have to call the emergency room and the ambulance, and she'd have numbness, or back or legs would go out on her. But when I graduated from chiropractic school, I started working on her just because I understood the principle that everybody needed a healthy spine and nervous system, and she started getting better, and she's 74 years old. I mean, and to have a 50-year MS diagnosis and still be alive, much less not in a wheelchair and thriving, is unheard of. So it just showed me the power of what we're working with, and how what a powerful thing when we can get the body, just give the body a chance. So that's why this is so important to me, and this is why I don't just bring up the neck pain and the back pain. And I want people to know that there's always hope if you get the body working right, that it can heal. Now, that's my son. He was born, well, he's 7 now, but he was in the NICU for 10 days. This was his diagnosis. He had a failed APGAR score. He had a pneumothorax, which is air between the lungs and the rib cavity. He was diagnosed with reactive airway disease, asthma, nystagmus, which is when your eyes wiggle, reflux, colic. They said he'd never play sports and he'd always be on an inhaler. And knowing what I know about the misalignment in this, of that upper neck, he was at a risk for SIDS, crib death. I mean, can't say for sure that would have happened, but knowing what I know, I was scared to death. So here's some pictures of him as a child. What do you notice about his head? You see how tilted and off center it was? That was from birth trauma. Even though we tried to do it as natural and as best we could, it just, the best laid plans don't always work out. So he was severely misaligned. And once we started getting him corrected, he started healing. He started doing well. And he started doing better. So let me give you the other extreme. This is my daughter. She was born, and I've checked her from birth, and she's been clear and never needed much of an adjustment. Now, if you can see this big lump right here, she fell and hit the door jamb. My wife called me here at the office and said, this is growing while I'm watching it. So anyway, we brought her to the office the next day, and sure enough, she was misaligned, and we corrected her, and now she's good to go. She's almost 4. She's only had a couple of adjustments. I check her regularly, but she doesn't need much. The goal is not to adjust things, it's to make sure that you're working properly, spine and nervous system. So, and my wife's got a healthy spine, and this is where we are today. And this is the baseline of our health, and it should be the baseline of everybody's health in their health program. I'll tell you this about Wyatt. He did not miss a day of school last year. And when they get a fever or a little cold, it's a day or two and they're back to normal. Every time they get sick, I bring them into the office, we check them. But guess what? Most of the time, they're not misaligned because kids get sick and that's how they develop their immune system. But sometimes they are. And it's a chicken and the egg thing. Could they have been misaligned and now their immune system's depressed, or their immune system's depressed and it causes them to misalign? So we always check them, and if they're out, we correct them, and it allows the body to work better and they heal quicker. So it's a big. So whenever you hear someone say, "I don't want someone to crack my kid's neck," well, I don't either, and that's not what we do, and I don't know where people get that from, but people just don't know. So again, that's where what I'm teaching you will benefit you, because it's heartbreaking to see, especially children and infants and toddlers suffering when very often they can be helped, and be helped fairly easily. So Wyatt and Grayson, both my little princess and my little surfer boy, they both want you to have your best life possible. Remember, we talked about life comes from the nervous system, and so do I, and that's what I want for people, and that's why I do what I do. So, and I used to tell people, well, I hope this made sense to you, and I hope you'll tell somebody about it. But now I feel like with knowledge comes responsibility. And so if something like I've said made sense and you think we can help somebody, I certainly hope you'll tell them about it, tell them about us, tell them about this kind of care. And again, if they're somewhere else, that's not a problem. We'll find somebody for them to get the care they need. So I always say, thank you for coming. And remember, if you don't tell them how they can get well, then who will? So